non-invasive ductal carcinoma. And just for the lady that was concerned about the 5 years, I had the onco test, and I think based on the measurements or the percentage, I was just right at the cusp. Therefore, I ended up having to have chemotherapy and radiation. And so I'm 4 years into post-treatment, and I'm thinking, oh, at the 5-year mark, I'm going to be done. However, at UT Southwestern in the center, I think Central Times or that little magazine, Center Times, there was a publishing about the benefits of that additional 5 years of treatment, because most people stop at 5 years and then sometimes there is a recurrence. So I'm just going for the gusto and trying to make it to the 10 years. But again, I would just like to point out, with breast cancer, it is individual specific. So you and I can have the same type of cancer, but your DNA, your genetics, all of that really plays a factor, from what my doctor explained. So, you know, I don't like it, but, you know, I'm just doing what has been suggested, and so far so good. I'm having some good results post-treatment. I feel great. Yes.